Absolutely. So our topic for today is lips. And I like to talk about lips because this is where I get to be a little bit of mea culpa and start saying I was wrong. And the reason that I say that is that, we look at lips aesthetically and we know that it's a popular treatment. Sometimes it gets a bad name when somebody, either the patient requested and they want something outlandish, or maybe the injectors are doing something outlandish and it gets made fun of with social media and the news and so forth. But lips are really key. Lips are really key when it comes to our interaction socially. It's part of our attractiveness, more so we see in women, but also in men, and it becomes a very frequently asked for treatment. Would you say that, Karina?
I would say so. Yeah, I would agree.
What percent do you think of all of the filler patients that we have want to have their lips enhanced?
Oh, that's a tough one. I'd say about 70%.
70%. Well, that's a lot higher than I thought.
Yeah.
But I would listen to Karina. She probably has a better take on that. So maybe 70% of the patients who come in for filler, for even other areas, they want something done for their lips. So I'm kind of a scientific, nerdy kind of guy, conservative medical guy with my past history as a general vascular transplant surgeon, and I like to think of things as a whole. Okay, and so a lot of times you hear me on Ask the Expert here on KSRO. You hear me, and Karina, we talk about this with the patients. We talk about, first, let's build the foundation. So I try to make analogies like building a home. Work on the foundation. Don't go right to the finish work.
Yes.
Okay, so we're not talking about the molding on the top ceiling when we're building the house. First, let's build up the foundation, the walls, and then let's work on the molding. And that's how I felt lips were. They were the sort of the molding, or they were the finish work. And so I would always try to guide our patients so the lips didn't look weird, to help them enhance their full face first. Okay, it wasn't a monetary thing, it was an aesthetic thing, trying to help our patients look natural and look great.
Yes.
Okay, and you, when we talk, still talk about that, right?
Yes.
Okay.
Yes.
And so we would try to enhance the face first, and then use the lips as sort of the finishing touches, right? And that was sort of my shtick with the patients. And I tried that for many, many years, 10, 15 years, and I think I was wrong. Okay, and let me tell you why. In theory, I still believe that I'm correct. And in the perfect world, I think it's correct. But the world's not perfect. And why do patients come and see us, Karina?
To feel better, look better.
To feel better. That's our mission statement. We try to enhance, our patients' self-confidence by enhancing their self-image through advanced technology in a safe, secure environment. That's our mission statement. And so that's what they're coming for. And so I lost a little bit of that, where I was putting on my kind of nerdy, conservative medical hat and saying to them, let's work on your whole face first before doing your lips, okay? And I needed to listen to them a little bit more. So I think there's a middle ground to that. It's not as black and white as what this Asian Greek, conservative guy from Detroit, Michigan was saying, is that, it's a little bit in between. And so I started to loosen up a little bit, Dr. Tom, right? And we started to treat some patients just their lips. And so let me use an exaggeration. A 70-year-old woman, so right around my age, okay, 70-year-old woman, and maybe hasn't done a lot, showing her facial aging and all, and then she comes in and she wants her lips done. And sometimes we'll treat her lips first, right? In the past, I wouldn't, but I have found that if you can do it aesthetically, in other words, with proportions, artistically, trying not to make it look out of proportion, because my concern was if you gave a 70-year-old person, man or woman, an 18-year-old lips, they're gonna look weird. It's gonna be like an island in the middle of the ocean, right?
And that's what you're gonna look at first, which is not
what we think, right? But if we can just enhance them a little bit, it can make a world of difference on how they feel, right? And what do you think? So most of these, let's say baby boomers, let's talk about my generation, not your Gen Z generation. What do you think they feel?
I would say that most of the women or men in this age category are almost hesitant to even touch their lips, and there's a little bit of convincing that comes into play.
Right.
Yes.
Right.
Okay.
So because I think that there is an idea of the overdone look that they have in their mind, but once they trust Dr. Tom, he'll say, just a little bit, let's put a little bit in there. And once they see that, oh my gosh, I actually really like this. And a little bit is a little bit.
A little bit is a little
A
bit.
little bit goes a long way.
And so let's just talk about that for a moment. Thank you for mentioning that, Karina. So let's just talk about a syringe. And there's all sorts of fillers. And right now, one of our favorites is the Restylane Kiss, Kysse. There's also the Juvederm Volbella, like Bella, hey Bella, and for our Italian host, Robin Berardini. And a syringe is 1 ml, 1 milliliter, okay? And so, Karina, do you bake at all?
You know, that's not my forte.
You're supposed to say yes. Okay.
I tried.
Okay. So do you know? Okay. So do you know how many ml are in a tablespoon of butter?
How many mLs?
ml.
In 1 tablespoon.
Tablespoon, not a teaspoon. A tablespoon.
A tablespoon. It's 5. Yeah.
5 is in a teaspoon. So
5 is in a
that's
teaspoon.
okay. That's right. It must be my Chinese English, my Hispanic medical assistant didn't understand.
We discussed this about math.
Right. Okay. So a tablespoon. So think about 2 tablespoons on a stick of butter. Okay. That we all know how it's 2, 4, 6, 8. Right. So 2 tablespoons is 30 ml. 1 tablespoon is 15 ml. And there are 3, and that's what I think Karina was answering. It was answering to me. There are 3 teaspoons in a tablespoon. So a teaspoon is 5 ml. Okay. So a syringe of filler, everybody's worried about that syringe of filler.
Well, yeah.
Is actually 1/15 of a tablespoon, or 1/5 of a teaspoon. So you know that it's a small amount. And unfortunately, sorry, listening audience, it's expensive. It's expensive for us to get it. That's the way of the world. But if it does some miraculous, magical things. Just that little syringe. So that's what we will do. And a lot of times, as Karina mentioned, I might be injecting the face, and a lot of times with the baby boomers, once I get their trust and all, and especially I love it when it's an 80-year-old plus patient, female patient, and we're doing a little bit on the face, and I have just a little bit left, and I'll say to them, if you trust me, can I just put a little bit in your lower lip, right? And what's usually the response when we do that?
Oh no, I'm not really sure, and then, well, just a little bit, and then they really like it.
Do they?
Yeah.
I bet the lipstick goes on a lot better.
Yeah, lipstick goes on better, all of that, and it's amazing how much more confident the patient feels, and that's where I said I think I was wrong in sort of holding that line of, trying to rejuvenate the whole face. Because sometimes, well, one, it can be a cost issue. Patients may not be able to afford to do all the filler we want to use on the rest of the face. So what are we going to give them in terms of their biggest bang for their dollar? And we know that lips are really important.
Right.
Well, 70% of the people are coming in and wanting this service, seemingly so.
Yes, and that's of all people who come in for filler of all ages, right? And so what normally I do, Robin, and I know you always ask me an evaluation, so I sit down and I chat with them, and Karina's sitting in the corner because she's heard this over and over again, getting bored, and I know she's not, she's listening, and I'm evaluating the patient. We take photos, and then I sit down and we talk to them about what are their desires, what do we think is reasonable in terms of expectations and what we can achieve. And go through that, talk about the different types of filler, the cost of that, and then once we're all on the same board in agreement with that, then I turn the patients over to Karina for a little bit because she prepares them for the procedure for lip injections.
Well, talking about that, so the initial evaluation, you come in and we're doing the pictures and talking and getting the patient's feedback, and then handing over to Karina. Now, what do you do to prepare them for that? Is that now in your hands?
Yeah, preparation for a patient is cleaning the lips off. That's the most important. Lots of rubbing alcohol. So we want to have a clean area to work with, and then numbing. Numbing is important. There is a little bit of numbing in the filler itself, but we're doing quite a bit of pin pricks or needle pricks, and it can be uncomfortable, especially the lips are a very sensitive area. So cleanliness and then numbing. It's a topical numbing. It's a lidocaine. Put it on the lips. We tell the patient not to talk, so we have to kick Dr. Tom out because he loves to talk.
I actually do. I get banished from the treatment room, but Karina's like, "Go work on your emails." And how long do you keep me out of the room?
We like to keep it on there for about 10 minutes.
Okay. So the topical goes on for 10.
Topical goes on for 10 minutes, and then removing the topical. It is a little bit of a kind of like a Vaseline kind of consistency, gooey. So we want to make sure that it's all cleaned off again. So cleaned off again, and then prepped for Dr. Tom. So cleaned off, nice and dry, and lots of icing. Have lots of ice.
How long does that process take to get the lips, numb enough to do the injections? And is it just the numbing cream, or is there a numbing injection?
For us, generally, numbing cream goes a long way. On occasion, maybe a nerve block.
Maybe I'll do a nerve
Tom.
block, but that's very rare nowadays because most people don't want to walk out like they do when the dentist and they feel like they're numb in their mouth. But we do have that, and I used to do that all the time that way. But now that there is local anesthetic in the filler as well, the discomfort really is that initial pinprick. But again, and everybody's pain threshold is different, and so it's wonderful to have Karina. So Karina is putting on the topical anesthetic, as she mentioned, and even with that though, because I'm an empathetic injector, I have had my lips injected, and I actually don't use topical anesthetic. I just have Mary, our lead nurse, just injects me. Okay, I don't. I pull that macho man thing. I don't need that. Just check my lips, and then of course they have to pull me off the wall. No, I'm kidding. But they, so she just injects me. But we put that on. I still use ice, and I use ice for a couple reasons. Ice will enhance the anesthetic effect of the pinprick. It also helps to minimize swelling. Okay, so we ice the area as well, and then we have also another little distracting trick, and actually. Karina, why don't we talk about that?
Yeah, our distracting trick is actually a vibration device. It's called the Eleanor.
We dubbed it the Eleanor.
The Eleanor, and it's placed by the chin or the jawline. The vibration helps keep the patient's mind off of what's going on within the lips.
Right. So we're really in tune to comfort for the patient as best as we can. And so that vibrating device, for those who are a little bit medical, or maybe somebody who's had chronic back pain, you may have heard of those TNS units, and it's a vibratory unit that's on another part of your body, which kind of is supposed to confuse the brain, and then your kind of brain is focused on that vibration versus on that chronic pain area. So we use this device, which we lovingly dubbed the Eleanor, and we use that as well to try to make this procedure as comfortable for the patient as possible.
All right, and when we're waiting for the numbing cream, how long does that take?
About 10 minutes.
About 10 minutes, okay. And then Dr. Tom has to be kicked out of the room because we need to keep the lips.
Right, we don't want to get the topical anesthetic in the mouth because then it numbs your tongue and so forth. So.
And it tastes really bad.
And it doesn't taste good. So that's why I just don't even bother with it. But again, most patients opt for that. And on a few days when I actually let Karina have a day off, they're all wondering where Karina is because they want the vibration of the Eleanor on their, next to their mouth or on their jawline, which really does help to make a difference in terms of distracting your perception of discomfort. So we do the procedure, and most people, we just send them home. What do we do afterwards in terms of sending them home?
After care instructions, there's a printout for them. We usually hand them ice to take home. Icing is very important for swelling and discomfort on and off. They're reusable, so you can pop them back in the fridge. We always tell them don't put them in your drinks. They're not for that, but definitely avoid any hot, spicy or hot temperature-wise food for that day. Your lips are numb. You're not feeling quite all that in the lips, so
you could have get burned or something, hot tea.
We just don't want you to injure yourself, and then minimize activity for that day. So no big, hiking or
going to the gym immediately afterwards,
playing hockey,
playing ice hockey.
Yes,
right? We
most
don't want you to
definitely.
do that.
And most of that is just for this swelling, and just let your body recover. Lots of hydration. Drink your water.
And then
take
how
it
long
easy.
will the post care be? And the next day, can we pretty much go back to regular activities?
I'd say yes. Yes. However, there can be a little bit more swelling the next day. So
it is patient specific.
Yeah.
I will tell you that we inject people all the time and they go right back to work. Okay,
Oh, okay.
And so it shouldn't have to. But there are some people who just swell. Okay, it just can happen. So we do forewarn people that maybe they may have swelling for a day or two. So it's not something you want to do the day before your wedding,
yes,
or the day before your high school reunion, or a photo shoot at J.C. Penney's. You want to do this. Give yourself a week, but usually, I get it done and I just continue to work. The staff, of course, we're in the cosmetic surgery world, but we just go right back to work. And I think that most people do, but if you want, maybe plan on just a day where your lips are going to be a little bit more swollen, and that's usually the case.
Icing probably is one of the best remedies post-care, yes?
Ice is absolutely best. So ice is really important. And Robin, I think that was a great description. Thank you, Karina. It's exactly what she was telling you on the air is what she discusses with our patients. And one of the reasons I wanted to bring Karina in was actually to have us talk about, like the different lips and what we do, the different kind of patients, and kind of our evaluation. And I'm just going to start by one little thing. And Robin, you're pointing at something. Was there a question that you had for me? I didn't see it. I'm sorry.
There's a ratio, isn't there, when you're doing the upper and the lower lip?
There's a ratio, right. So what I'm going to call is the more natural ratio is that your lower lip should be at least 60% larger than your upper lip. And people don't believe that, okay? But that's actually the way to not have fish lips, okay?
Right.
Is to have the lower lip be larger. And it should be classic beauty, about 60% larger than the upper lip. And this is in women, okay? And a lot of times women, especially if they have thinner lips or they're a little bit older, and when I'm talking to them, I said, if you let me just put a little bit in your lower lip, we're gonna make your upper lip look bigger, and I've done nothing to your upper lip.
Really?
It's by enhancing the lower lip, and it makes it just a little bit of a pout. When the light hits the upper lip, it bounces up into the upper lip area, and then therefore it makes it look a little more prominent. Just like putting filler in the cheeks makes the eyes pop more. So we do that. I would say that maybe in the older population, the more and I'm going to say more traditional, I don't want to say conservative, more traditional natural look, the lower lip should be 60% larger than the upper lip. Being a Gen Zer, and I know that not every Gen Zer is the same, Karina, but what do you think some of the younger population is? And sometimes it can be cultural as well, but what do you think?
I definitely think that the Instagram look, and what that would be is the upper lip is a lot fuller. There isn't a lot of lines in the lips. They're pretty full. Would be kind of the trending or more of the desired look for the younger generation. And again, I told Dr. Tom, I said, lips are kind of like breasts. It's not one size fits all.
That's
so
right.
It really is different faces, different shapes, different ethnicities, different what we perceive as beauty. So as much as we always want to give the patient what they want, sometimes we have to say, well, that's not your lips. That's not what we can do for you. So
Exactly.
realistic expectations.
There you go.
She's so smart. I love Karina. Isn't she smart? Man, she's awesome. So Karina is right. So for instance, my spouse is English, German, Irish, my age, baby boomer, and she has thinner lips. So if she were to come in as a patient and show me a picture of Karina, this beautiful, Gen Z Latina, and say, I want those kind of lips, I'd have to tell her, I can't do that for you. I can certainly make your lips look prettier. I can add some volume so they look more youthful, but I'm not going to be able to give you, sorry, Northern European, English, Irish, German gal, I can't give you these Latina lips, okay? Now we know that there are some Northern, there are some Irish girls and English girls who have fuller lips, and sure,
Right.
those you can enhance more, but the more typical thin lips, you can't.
Right.
What about men? Are men coming in? I know you said that you did personally, Dr. Tom. Are you seeing men come in and doing it?
Absolutely, you will, and this is going to be on YouTube so people can look at my lips. And what am I doing on YouTube? I was just looking at the camera for those who are in the radio land right now. And so I had my lips injected. I'm a baby boomer, and because I didn't want to, love this little analogy. There's, the cartoons, and you see the old guy in the car in a cartoon. It puts his head out the window like dogs put their heads out the window, and the lips are flapping away, right? And I didn't want to be that guy. Okay, so I just wanted a little bit of enhancement. So I had Mary, Marley nurse, and Karina was holding me down, putting the vibrator on my forehead. Okay, but they just added a little bit of volume to my lips, so they look a little bit fuller, so they look healthier. Again, it goes back to many shows that we do, Robin. If you can make yourself look healthier, that translates into younger, more attractive, more youthful, all of those kind of things. So just a little bit can go a long way, especially in men. There is a difference. We've been talking about ratios, and Karina, and that's really more for women, right?
Women.
Yeah, women. And so again, it's lower lip is 60% larger than the upper lip for the more natural look, for that Instagram look, or maybe even for, I'm going to say, that Latina look, in terms of where the upper lip has that nice, beautiful eversion, kind of flipped up.
Yes.
That they may approach more of that 1-to-1 ratio. Okay, and so that's what we see for women. But now in men, and we've had a show in the past, Rob, when we talk about aesthetics in men and so forth, and we talk about men, that men can have a masculine face or they can have a feminine face. Okay, and I always use the example of two actors, handsome actors that work together, and that's George Clooney and Brad Pitt, right? So George Clooney has that masculine face, okay? And Brad Pitt, believe it or not, has a feminine face. And if you were just, so everybody not if you're driving, okay, KSRO land, but when you get home or whatever, Google it, get on the internet and kind of look at it and look at their lips. You'll see that George Clooney's lips are thinner, and the upper and the lower lips, not perfectly 1-to-1 ratio, but they're a little bit more of a 1-to-1 ratio, okay? And so when we look at Brad Pitt, and Karina, do you even know who Brad Pitt is?
I do.
She does,
Yes.
okay. Because normally she makes me feel old when I mention someone and she's looking at me like, who are you talking about? Okay. This is our Beauty and the Beast show. And I'm the Beast, okay? We got the young beauty here.
No.
But Brad Pitt, when you look at his lips, do you notice anything different about his versus George Clooney's?
I can't picture his lips right now. I know.
Okay,
Yeah.
all right, well that's good. So that's the challenge. So I'm going to ask Karina to go back home and look at it when we get back to the office, and you'll see that Brad Pitt's lower lip is way bigger than his upper lip. Okay, so I know that at one time he was married to another very lip famous celebrity, Angelina Jolie, and when you look at that, you'll notice that his lower lip is much larger than its upper lip. It's a more feminine lip, and if you just sort of take a little box and cut that out, you'll notice that. Okay, so we look at the individual. Okay, did you? By the way, Michelle, I saw you.
I did just go look
pulled
at
it up.
And so, what did you find, Michelle?
Yeah, it's very much more prominent lower lip than the upper lip.
And if you were to take a box and cut everything else away, crop it away, it has a more feminine mouth. And certainly, no one would call Brad Pitt a sissy boy or anything like that. Handsome looking guy, right? And so the feminine masculine thing, that it's an interesting take on men's faces and their lips.
Again, patient specific, seemingly so. Oh my goodness, there's so much to talk about. Well, we've got a couple more minutes now as we kind of review what we're here with Karina and Dr. Walter Tom and Ask the Expert, talking about lips today. Can you go over kind of just like an overview of what we've spoken about to get the Reader's Digest version? So that snapshot.
So very quickly, evaluation, photographs, take a look at the patient, what are their wants, desires, trying to align what we think we can accomplish for them that can be reasonably met. Karina is here to help us, and what are our quick techniques, Karina?
Oh, numbing for the patient, cleanliness, and then before and after care instructions.
Right, and so all of that, and we're there for you. We're a phone call away, and that's the treatment for them, and it makes a huge difference. And that's where I actually underestimated how important the lips are, especially for women, but how important they are no matter what age the patient in terms of helping them to feel more confident and better about
For
themselves.
both men and women. And Michelle, what's that little saying? You have the millimeter of...
Oh, an ounce of prevention is worth a pound of a cure? Yeah, just a little bit.
Just a little bit goes a long way.
That's right.
Perfect. Dr. Walter, Tom, and Karina, thank you so much for
Thank
being here.
you.
Will you come back
Thank you.
next week, please?
Yes, actually,
I
I
love
think we're
being
doing
here.
lips part 2.
707-542-8346. Dr. Walter, Tom, Michelle Marquez here, and KSRO News coming up next.